Hey there, Dr. Michael Lepore here, coming to you today from Sarasota Vascular Specialists to talk to you about lower extremity PAD. When we talk about treatment, for all of us at Sarasota Vascular Specialists, we really approach this from a very conservative standpoint to a more invasive standpoint. And even these more invasive techniques are pretty minimally invasive, but still have good outcomes. Prevention is probably the first and foremost. Typically, by the time the patients have come to us, they've unfortunately not been doing a lot of prevention. That's how they got to us to begin with. But once they get to us, we want to stop it from progressing. So we try to do risk factor modification. And that ends up being changing the diet. If it's somebody who has diabetes, we have a conversation about the importance of controlling blood sugar, managing that portion of their diet. Genetics you can't run away from. So if you have a genetic predisposition, early screening for those patients, and those patients are going to have to be watched very closely as well. Cholesterol management, and that comes with different types of medications, whether it's statin drugs or other types of medications to help with cholesterol management. A good number of patients can be treated through an exercise program alone. In fact, about a third of patients on just placing them on an exercise program where we have them walk in a place that's comfortable for them to be able to rest and sit down for a period of time, allow the legs to recover and walk again, at least several times a week on a dedicated walking program, can improve their walking distance, sometimes double or triple how far they're walking. And that may be enough to allow them to live their lives the way they would really like. And so we would start there, and then possibly, if they fail that, consider medications. There's a medication called cilostazol. Platal is the drug name. Cilostazol is the generic name. And that medication can really help patients double or triple their walking distance. Of course, it has some side effects like all medications do. So we're pretty thoughtful about trying not to put patients on more medications because many of our patients already are on them. But we would try to exhaust all of those more conservative means of treatment before we get to more invasive treatment. And the more invasive treatment, when I say we still always typically start with minimally invasive treatment, and that would be consideration for angiography, where we go through a small puncture site in the artery, typically in the groin. Sometimes we have to go through the artery in the arm to find the blockage, possibly cross the blockage with certain tools that allow us to get through the blockage, clear the blockage up with different techniques using laser or other type of atherectomy devices that ream the artery out or clean the artery out, and then possibly balloon, stent the artery if necessary, and different types of treatment modalities like that. Versus open surgery, which ends with some type of a surgical bypass, where we have to actually reroute the blood flow, typically from the groin down to one of the arteries further down in the legs. That being said, I would say that probably 70 to 80% of patients can be treated with the more minimally invasive endovascular treatment based on the fact that our tools that we have in our toolbox with regards to vascular surgery are really much more advanced than they used to be able to perform all of those different techniques. So again, I'm talking about the treatment of peripheral arterial disease. We discussed a little bit the importance of risk factor modification and trying to get patients to change their diet, exercise more, control their diabetes, blood pressure, screening with regards to backgrounds and genetic predisposition. That becomes important as well. Progressing to the possibility of medications, if it can be treated like that, after putting them on an exercise program to see if they'll improve initially, which many patients do. And then proceeding lastly to minimally invasive techniques in the endovascular suite through percutaneous techniques going through puncture sites in the groin or arm versus open surgical bypass in order to restore flow. Dr. Michael R. Lepore here talking to you again today about lower extremity peripheral arterial disease and its treatment. Please place anything in the comments or questions and we'd be happy to answer.